Okay, recording.
Terrific. Well, it's a pleasure seeing you again, Doctor.
Thank you, Jane. It's a pleasure to be here.
Thank you. We're really pleased to present this early evening on how does pain affect older people. This is a collaboration. This presentation is a collaboration of the Armenian American Mental Health Association and Alzheimer's Care Armenia. So Dr. Jack Ayvazian and myself, we're very happy to be here. I am Dr. Jane Mahakian, and I am a local gerontologist in Orange County, California, and I'm also a licensed clinician. I specialize in working with people with memory impairments, such as Alzheimer's disease and other types of dementias and their families. I'm also the founder of Alzheimer's Care Armenia, which is a local nonprofit here in California, as well as a registered NGO in Armenia. And that program was started, Alzheimer's Care Armenia was started in about 2017 to create sustainable programs and services for people in Armenia. So I'm pleased to once again collaborate with you and present this very informative webinar for people.
Great. Jane, you do such good work. I mean, I am just in awe of the things you're doing. I mean, you're not only doing it here, but then you also go to Armenia and have been working with the good folks over there. And so, in doing things that are so relevant for our population today, because we really do have an increasing senior population and dealing with their health and their medical and mental health needs. I'm Dr. Jack Ayvazian, and I'm a neuropsychologist in Los Angeles. And for those who aren't sure what a neuropsychologist does, we are clinical psychologists who have additional training in neuropsychology. And neuropsychology is assessing how people are thinking. So how is their memory, their verbal skills, their ability to plan and organize, and their visual skills, visual spatial, fine motor, gross motor. So we do the emotional component that psychologists do, but we also do that cognitive component as well. And so I'm really glad that we're doing this today, focusing on our seniors and how pain affects them, and including seniors who are dealing with dementia or memory issues.
Sure, because as you know, worldwide, there are about 35 million people with dementia. And about half of those at any given time are experiencing some form of pain, whether it's acute pain problem or more chronic type pain problem. And one of the difficult things to do, as you know, is to tease out really what's going on with that person that has a memory impairment. Once their behaviors start changing, is that due to pain or is that due to something else going on? So people with dementia feel just like you and I do. They may not remember what they had for breakfast today, but they do feel and they do experience, as we do, pain. But what makes it difficult is that they cannot communicate like you and I do and express our thoughts and feelings in an appropriate way, or in a way that really gets that person, the caregiver or family member, to know what's going on with him or her. So that's why pain many times in nursing homes, community setting like assisted living community, or even at home with our loved one, the pain goes undetected and it really goes untreated because that person isn't communicating.
I think that's so tragic. Oh my gosh. To think that they're going through pain, and because of their cognitive issues or their memory issues, it's affecting the way they're communicating, and they're not able to communicate that they're having pain. And it's relevant not only in the general times, but it's very relevant now with the COVID-19 situation, where we're having our seniors living with us. They're moving from their board and care facility, perhaps moving in with their families, and we want to help those families deal with these patients better.
That's right. That's very, very true. And because they can't use words like you and I do, it they begin to display behaviors. So I can paint a picture of a dear patient of mine, not her real name, of course, but we can call her Caroline. Would you like me to paint a brief picture?
I'd like you to do that, because
okay,
it'll help us, and it'll help our population and our audience better understand kind of what we're talking about here, and the type of person that may be even related to you. Because I know that my own mother is she's a senior, she's dealing with pain, and she's dealing with memory issues. So this is very relevant for her, but I'd like to hear about Caroline to see how she might relate to us.
Right, exactly, right, because we all have a Caroline, right?
Absolutely.
We all have parents or loved ones that, have these type of problems, and it's very common now to have a dementia. But so Caroline was around 83 years old when she was first diagnosed with Alzheimer's disease. She was generally a very happy person, very even mood, very easy to get along with. They were really very pleasant person. She was an accountant, so she, retained a lot of her cognitive skills to a certain point, and just really enjoyed life. Over a period of a couple of days, and she lived with her daughter. Her daughter began to notice that she was just not happy. She was becoming more tearful. She was frowning more. She would sleep in, which was not the norm for Caroline, and the daughter really didn't know what to do, what was going on with her. As the days progressed, she became more irritable and started lashing out, verbally at the daughter, and which was very not like Caroline. So what happened was the daughter took her to the primary care doctor, who suggested that the family consult with a neurologist. And there was a neurologist on Caroline's team, and the daughter did in fact do that. And it turned out that with the two doctors collaborating, that they were able to tease out that this was not, a urinary tract infection, for example, that would cause these kind of behaviors. But actually it was lower back pain. And the neurologist was able to tease out this was not a decline in her cognition, but due to the pain, she was exhibiting these symptoms. So once that was diagnosed, the pain was properly diagnosed, both physicians in collaboration decided what medications would be best for her to address that pain. And medications also, as you can imagine, many times pain medications can cause constipation. So we together with the doctors decided on a pain medication that would not cause constipation, but yet would address her pain complaint. So it had a happy ending. The pain was addressed and all of those behaviors disappeared, because those nonverbal signs of pain, which we're going to go into today briefly, such as, clenching one's teeth, frowning, asking for help, and then when you give the help, it's not what they want, and then they ask for help again, grimacing, pacing, excessive pacing where they weren't doing that before, fidgeting, tensing the body. These are all nonverbal. Any kind of gait changes, balance changes, sometimes what people call wandering, I kind of call it exploring, right? When a person explores more than they normally do. These are all signs, nonverbal signs of pain.
Absolutely. And then I am always concerned about what medications a patient is taking, and especially a senior, because oftentimes they're taking too much medication, or they're not taking enough of their medication, or they're taking it at irregular times when they're not supposed to be taking it, or they're combining medications when they shouldn't be doing that. And so I always like to make sure that their physician is aware of their medications and is assessing whether the medication is being taken properly, because that might be affecting their physical functioning as well. And you had talked about how the non verbal signs of pain, that the patient may not necessarily say, I'm feeling pain or I'm having pain in this area, but they're exhibiting these behaviors, which were numerous that you mentioned. And there may even be non-behavioral signs of pain, such as rapid heartbeat or high blood pressure or rapid breathing, grimacing. And then you had also mentioned flailing or movements that may be due to pain, and we can be sensitive to those, and we can bring those up to their physician or to their family members.
And good point. And also too is any changes in emotion or cognition. So increased confusion is one of the hallmarks of pain. Crying or irritability or agitation, not wanting to be as social. Of course, nowadays, with our, with this social isolation and the COVID-19 crisis, we are now hunkering down at home. We are at home. So even then, not wanting to do FaceTime or Skype, reaching out to loved ones on the telephone. So decreasing social interactions and more in reverting kind of inward is one of the signs of a pain.
I'm glad you brought that up. I've had pain issues myself, if I've injured myself or if I'm ill, and it actually makes me depressed when I'm in pain. One of the causes of depression is a feeling of lack of control in your own environment. And so that can cause a person to be depressed or anxious. And then conversely, depression or anxiety can cause a person to feel more pain than they might normally feel. So we not only want to see if the person is getting an emotional response from their pain, but to treat the emotional response or to treat their emotional functioning so that it may not cause more pain than they normally would feel. That's why the mind-body connection is so important. And oftentimes when a patient is feeling depressed or anxious or is having an emotional issue, I like to tell them, when we help solve your emotional issue, you'll be able to better manage your own medical issues and pain because you'll have the motivation to do so.
Sure.
And you'll have a more emotional and cognitive capacity to do that.
So you work closely with the primary care doctor and the neurologist.
I do.
So addressing that depression as well as that pain complaint.
I do, because I see them as all intertwined. I like having a collaborative relationship with the other professionals who are taking care of my patient. And I always learn from those other people things that I can bring into my own treatment with the patient. And they learn from me as well.
I remember many years ago, I was a psychology intern at the VA in San Francisco. And one of the things I learned, because I was in a pain management specialization, was to use guided imagery with the veterans. Is that something that you would recommend? And how do you work with your patients that have pain?
Oh, I do. I think that's a really good idea. And I always like to get information about their pain. I like them to rate their pain, which issues are giving them the most pain, and to describe their pain and rank it from maybe 1 to 10. So I have a good idea of what pain issues they're dealing with. And it helps them feel more in control when they really understand what they're experiencing themselves. It helps me understand them better. And then we can implement some type of treatment for them.
Excellent. Excellent. That's great. What are some of the first steps that somebody should take when they notice that their loved one's having pain? For example, when Caroline began to exhibit these different behaviors, the daughter really didn't know what to do. She had reached out to me to say, what do I need to do? There's been a change in my mom. So I recommended that she reach out to the primary care doctor to have like a urinalysis done, to have some blood work done to kind of rule out more infection type issues going on.
Again, there's that mind-body connection, and there's that collaboration with the other people working with the patient. Those are very good ideas. Again, I try to help the patient understand their pain. I always have this saying that if you can name it, you can tame it. So if they know what they're working with, it's something that we can then help solve together. I also try to help the patient understand that not one modality is going to necessarily help their pain, but it might be physical therapy, it might be relaxation techniques like which you mentioned, guided imagery, maybe acupuncture or alternative medical approaches are good, and of course medication. The medication evaluation will be important for them.
Right. I think, don't you feel too, is nowadays is that many patients have numerous doctors, and they may have 4 or 5 doctors, and those doctors are not communicating with each other. So many doctors do not know really what is this patient taking, right?
Oh, and that
Who's
brings me back to
prescribing
that
what?
medication thing. Absolutely.
So one idea I have is I always tell all my patients, put all of your medications in a brown paper bag and take them to that doctor that you're seeing so that they know what you're taking. So that's a good idea, especially when it comes to pain complaints, because that, how it's addressed pharmacologically makes a big difference.
Absolutely. And then also, you had mentioned making everything all together in terms of the medication so that there's not necessarily medication contra effects and things where they're taking medication from one prescribed by one doctor with a medication prescribed by another doctor, and there could be a counter effect. I even go so far as with my own mother, I keep all of her information in a notebook with separators for their different doctors, so that when I'm at one doctor appointment with my mother, then we can find out what the other doctor had said if that doctor asks, and I can very easily flip into that area and say, oh, well, she saw this doctor on this day, and this is the medication that was prescribed, and this was the diagnosis that was given. So everything is sort of comprehensive and kept together.
That's a brilliant idea and a really wonderful suggestion.
Thank you.
Because it keeps it very organized. And that is the key to providing your mom the very best care that's possible.
I like to say it works for mom.
It works, definitely.
Absolutely. And there's other issues that I think are important in assessing pain, and especially assessing pain for somebody who has memory issues and has trouble communicating right. I want to know, have they recently had dialysis? Is this pain possibly post-surgical reaction, or are they post-stroke, so that these medical issues may be a part of their pain? Are they dehydrated? Are they having nutritional problems? Are they having metabolic issues? Or is there a history of head trauma or dizziness? So that's why I think a good physical examination is always important, so we might understand the etiology of their pain.
That's a really good recommendation.
Because the patient with dementia or memory problems may not be able to list those things.
Right.
So I want to talk to family members to get that information.
And they may not remember that information too.
Exactly.
Or they may embellish that information and it's not accurate too. So that could happen too.
That's why the family members and I always have a good relationship.
That's right. Exactly. That's very good. So if somebody wants to reach out to us and they have some questions more about depression as related to pain, dementia as related to pain, how should they reach us?
Well, I have a website, and my website allows people to then reach me through by email, and it's just drjackavazian.com, AYVAZIAN.com. And also on my website, there are resources that I think are useful for everybody, given different issues that they may be dealing with. And it also explains what neuropsychology is all about in clinical psychology. Helps educate the public.
That's very good. That's what it's really all about. And if people would like to reach out to me, they can simply send me an email at drjane@alzheimerscarearmenia.org.
And that, again, that's that wonderful work that you're doing, reaching out to people not only in this city, in this country, but in Armenia as well. And I look forward to doing future webinars with you, Jane, on different topics dealing with COVID-19 right now, but then also when this crisis is over and continuing to provide education to our population.
I feel the same way. Absolutely. And as always, thank you very much.
And it's a pleasure,
Good
Jane.
to see you. Thank you. Take care.